The ICE and SPIKES models are well-recognized frameworks that can be used by candidates in communication skills, and it can help you frame your discussion for breaking bad news. SPIKES can be split up into Step 1, Setting. Make sure that you're in a private setting and invite the daughter to bring along someone for support. Before meeting with the relative, you will have already confirmed that you will have the patient's consent to discuss their case with the relative. Step 2, Perception. Use the before you tell, ask strategy of starting with an open-ended question, such as, "Thank you for meeting with me today. My name is Dr. X. So, we are meeting today to discuss how to best manage your father's condition, and in particular his pain control relating to his cancer. But I just want to start by establishing what you understand about his condition presently." The response to this open-ended question will allow you to determine how much the relative understands and at the same time offer the relative the opportunity to pose questions to you. Step 3. Invite the relative to express how much they wish to know. Examples of questions asked to the patient would be: sometimes patients and relatives want to go into detail about the management of their care, and other people would prefer to focus on the specific points. Before I start, I just wanted to establish what you wanted to discuss and how much detail you would like me to go into. Step 4. Giving knowledge. Unfortunately, I've got some bad news to tell you, or I'm sorry to tell you that. I'll just run through 4 important points to consider. Point 1. Pitch the discussion at the level of comprehension for the daughter. Point 2. Make sure that you use non-technical information. Point 3. Give the information in bite-sized chunks rather than all at once. And point 4. Periodically check the person's understanding. At this point, it would be appropriate to discuss specific end-of-life issues. Introduce this by saying something along the lines of, "When patients have terminal cancer and are nearing the end of life, there are specific targets for treatment that we try to address preemptively. To counteract pain, we prescribe medications that sometimes contain morphine. If the patient is unable to take this by mouth, then we can give this by injection, or sometimes via a pump, to keep on top of pain. One of the side effects of morphine-based painkillers is constipation, and so to avoid this, we usually prescribe laxatives to keep the bowels regular. Agitation is also common, and we will prescribe medication that can be given in case this occurs. Regarding the daughter's concerns about the father suffering and speeding things up, you need to explain that although there is nothing that can be done to speed things up, one of the side effects of morphine-based medications is something called secondary effect, which is that some of the medication that helps with pain control can in turn slow the breathing. Step 5. Addressing the emotions and offering an empathetic response. In this case, the daughter is concerned about the prospects of her father's suffering, and certainly for a long period of time. Although you can't offer precise details, explain that when patients are less rousable and as poorly as her father, we are probably talking in terms of days to short weeks at the most. Step 6. It's time to wrap up with a strategy or to summarise. Patients or relatives who have a clear plan for the future are less likely to feel anxious and uncertain. Before discussing a treatment plan, it is important to ask patients if they are ready at that time for such a discussion.